Now it's time for the Keeping It Real portion of Real Talks. My name is Trina Celeste Gatson, and I am here with Dr. Edie Hapner. Thank you so much for joining us.
Thank you for having me.
Congratulations on your new elected ASHA position. Tell us a little bit about the position and what you're most excited about in the role.
So I'm the Vice President of Planning, and I will serve in that role on the ASHA board for 3 years. And it's such an honor. I'm very overwhelmed, truthfully, to have been elected to that position. As the Vice President of Planning, I'm involved in all the literally daily work of the board, but I am also the monitoring Vice President for the Multicultural Issues Board and the International Issues Board, where I really don't monitor anything. I sit back in awe of the work of these amazing people, of my colleagues, in their respective areas. In the 4 or 5 months that I've been in this role, I've learned so much from them. And ASHA's initiatives in other countries to help other countries develop speech pathology and audiology programs, the Multicultural Issues Board's work in our country to make us culturally competent, or actually to teach us that we're all culturally competent, but just kind of to get us up to speed in other areas. I also co-assist the monitoring vice president for the Financial Issues Board. Okay, and let me tell you that financial planning and financial issues is a very big job for ASHA. I am proud to say that we are a very strong 170,000 member organization with good, strong investments and a great vision for the future. And speaking of vision for the future, that's my main job.
Okay.
So my job as the Vice President of Planning is to envision what our lives are going to look like as speech pathologists and audiologists in the year 2025.
Wow.
ASHA's 100th anniversary. It's a bit of an overwhelming task because as quickly as things are changing in this country, to think about what we're going to look like as a profession in 11 years. How will we be practicing? How will we be paid? How are we going to educate people for all these new models? What's the organization, the association going to look like? Males, females, you know, multicultures. So it's very exciting. It's a little nerve-wracking, but thank goodness I have the guidance and hand-holding of some incredible national office staff. So I'm thrilled.
Awesome. You spoke a little bit about the future, and in your talks you spoke a little bit about prevention. You have coordinated one of the largest free community-based head and neck cancer screening programs, one at the Atlanta Motor Speedway. Tell us about the NASCAR program and what just keeps you jumping for joy with that.
Well, first, it's the most fun thing I do every year. We've actually been doing these screenings since 2006.
Wow.
So in the beginning in Atlanta, there were 2 races a year. We've conducted 10 total races, race screenings. We have 120 volunteers at each race screening. We screen 500 people a race. So we're approaching 5,000 people that have come to our MASH-style tent, complete with physicians and speech pathologists and medical students and dental hygienists and survivors from head and neck cancer whose sole goal is to teach the lay public about the signs, the symptoms, and the risks for head and neck cancer. You know, those risks are changing. So since about the last 15 years, so about 2000, there's been over a 200% increase in head and neck cancer in 40 to 60-year-olds who are non-smokers because of HPV. And the problem in this country is that the United States Preventative Services Task Force doesn't mandate head and neck cancer screenings for our yearly exams so people don't get screened. And if they think the only reason that they would have to worry about head and neck cancer is because they were smokers, they are sorely wrong. And the other problem is that people don't go see an ear, nose, and throat doctor. First, they go to their general practitioner. So it's often a huge delay before they make it to the ear, nose, and throat doctor, and people are diagnosed at later and later stages. Head and neck cancer is 95% curable in the early stages. So we started conducting these screenings in Atlanta. We have taken the screenings to the Indianapolis Brickyard, to Bristol Motor Speedway, to Kentucky Motor Speedway, and I actually have 2 that I know are going to happen, but I have to keep them secret, 2 more tracks, and one that I'm praying is going to happen. And I just need to say this. These screenings are my passion because speech pathologists work with people who have had head and neck cancer, who are recovering from surgery, who have gone through chemoradiation, who have had their lives changed. And rather than crying with my patients as they're recovering, I'd rather rejoice with people when they get diagnosed early or just are aware of the signs and get to the doctor early and they never have to make it to my office. I'm plenty busy. I'd rather they stayed healthy.
Wow. When you talk about prevention, what advice do you have to other speech pathologists or other universities that may want to find their niche in prevention and do something as extraordinary as the screening that you've done?
Well, you know, prevention is part of our mandate as speech pathologists and audiologists from ASHA, and I take that very seriously. And I think we do a fabulous job in teaching people about preventing hearing loss with even earbuds, or you know, preventing a long delay in getting children treatment for language delays. But we don't do a good job of easily encouraging our speech pathologists who, by the way, look in everyone's mouth.
This is true.
To just know what they're looking at and to know when it's time to say, I think you need to go to the ear, nose, and throat doctor. We will never diagnose because that's not what we do. That's not what we're trained to do. But if we can do anything to help get people to the doctor, our patients that are sitting in our office, I believe that if I look in the mouth, if I look at the larynx, I'm obligated to know what I'm looking at, and that also includes the early signs of head and neck cancer.
Wow. Awesome, awesome. So as a speech language pathologist, what factors contribute to your motivation and innovation with some of your research?
Well, I went to get a PhD when I had more questions than people were able to answer. And one of my mentors said to me, don't you think it's time you tried to get the answers for us? So a questioning mind, a never taking anything at face value motivates me then and now in research. Passion and interest and excitement, I think, are what keeps you doing research. No one should be fooled that the life of a researcher is easy. It's not. You know, we do our research in the evenings and on Saturdays and on Sundays, and we always have this little black cloud following us around until we've written up our research and tried to get it published so that it's meaningful. You know, the old adage, if it's not published, it's not yours. And it didn't really happen. So I think that questions, passion, interest, and so many things that are exciting and unknown are what drive me in my research.
Wow. Well, I definitely take that in as I just finished up my first year of the doctoral program. So
and you can do it.
I believe it.
It's an exercise in endurance. Keep enduring.
Okay. Okay. You spoke a little bit about technology and where our field is moving in the future, especially in regards to telepractice. What do you think from an educational university standpoint, where should we be going in preparing the next generation of clinicians in regards to telepractice and using some of the technology that you spoke of?
Well, you know, I want to talk about it even a little bit more globally.
Okay.
I can't imagine what our academic education systems are going to look like, or what healthcare is going to look like in the very near future. I just don't know. I know it's not going to look like it looks now. And in healthcare, I know that we're going to be mandated to practice in what's called IPP, interprofessional practice. And what that means is that every patient that I see, I'm going to treat as part of a very large team, and I'm just going to be part of that team. I might be doing things I'm not doing now. I might not get to do some of the things that I'm doing now, but I believe that higher education is the place where we have to start teaching our students to be prepared for interprofessional practice and for the ways that school systems are going to change the way they educate our students. Because if we don't start now, training all the students now, they're not going to be prepared when the world changes, maybe as soon as they get out. I know there's resistance to change, but I don't think this is an option. I believe that our future starts in academia and that change has to start now.
Wow. With that being said, do you think that there is a need in our profession to start allowing clinicians and students to go into specialty areas within the academic setting versus once they graduate and then decide to go medical versus school-based?
You know, that's such a hard question, isn't it? Because you're 22 or 23 years old in many cases, and you come out of undergraduate and you're going for your master's because that's our entry-level degree, and you may not even know all the possibilities in speech pathology. You know, exposure sometimes is just to pediatrics, and so, or schools. So how do you come in and know that there's a whole other world out there that may excite you? But I think we have to figure it out. Because I think in 2 years, I don't think we can teach everyone everything we need to know. And I think, unfortunately, waiting till the clinical fellowship to learn, you know, there's a lot of competition these days. I know how hard it is to get the clinical fellowship in our center. And so I think waiting and saying, I'll learn how to do that when I'm a clinical fellow, actually puts you at a disadvantage. So I don't have the answer. I have always felt strongly that there was a very big difference, not on a basic level, but on the step before graduation, between what we need to teach our school-based speech pathologists and what we need to teach our medically hospital-based, I'm going to say, speech pathologists. Even something as simple as reimbursement and coding and diagnosis and procedures. And I don't know how we do it, so I'm certainly hoping that someone in higher academics will be much smarter than me and come up with a brilliant idea.
Wow.
But we have to do it.
I agree. I agree. The last thing that we've been doing here at Real Talks is having you sum up your take-home message within 6 words. And so do you have 6 words to sum up your presentation and your overall message?
I think my 6 words sum up the way I live my life, and it's have the courage to be passionate. Have the courage to be passionate.
Fantastic. Thank you so much, Dr.
Thank you.
Hapner.
This was wonderful.
Awesome.